The South African National AIDS Council launched its National Strategic Plan for 2017-2022. In 2017, the plan is a roadmap for the next stage of the journey towards a future where HIV, TB and STIs are no longer public health problems. Now, part of the plan was driven by the UNAIDS target to have 90% of people living with HIV diagnosed, 90% on treatment, and 90% of those who will be virally suppressed by the year 2030. South Africa has observed this year's World AIDS Day on the 1st of December with the theme Bringing Care to Remote Communities in South Africa. For more insight on how the country is faring in its efforts to combat the HIV pandemic is Executive Director at the Advocacy for Prevention of HIV and AIDS, Yvette Raphael. Very good morning to you. Thank you so much for joining us. COVID-19 has essentially forced us to look into some of the loopholes that have really stood out when it comes to ignoring some really important initiatives and drives and healthcare, which really has been affected by COVID-19. HIV/AIDS, TB is one such discussion where we know patients have lacked in terms of getting access to antiretrovirals. Just give us some assessment on the bigger impact and what this all means for the targets set for the year 2030.
Yes, we all know that the targets are that we should end AIDS by 2030, and we are nowhere close to that. A number of situations have come up, a number of issues have come up, and we have warned our government. We have warned our government that if people are restricted during COVID, their movements are restricted, there should be plans in place to ensure that they are able to reach and get their their HIV prevention methods. We know it's difficult to reach communities, but we also know communities are now afraid to go out because of COVID-19. We are nowhere close to even reaching any of those targets. And in 2021, a year before, we should assess how far we've come with the National Strategic Plan. We see we are failing dismally on reaching those targets, especially the one where it speaks around keeping 90% of people virally suppressed, which will then contribute into people not being able to transmit the virus to somebody who's HIV negative.
What is otherwise possible when it comes to assessing the scenario at hand and averting the looming threat of death?
I think what is important is that we need to understand that in the beginning of the HIV pandemic was the concentration and the idea around focusing on communities and what we as communities could do for ourselves to assess ourselves. I think with COVID-19, it was coming in 2020, it was too high level. Nobody listened to communities and strategies that could work for us when we are working in the community. We are the comrades, we are the people that are on the ground and know our communities and how it would have been easier for them to access. One of the things that we said is important is to ensure that our communities get their ARV drugs ahead of time. So if you give somebody 6 months supply of their ARVs, they are then able to take their medication without any interruption. If you are giving somebody who is using PrEP, an HIV prevention method, 6 months in advance, they're able to continue to prevent themselves from HIV. And we've also warned our government that it's important that they look at strategies that will protect women during the coronavirus period or pandemic, especially around gender-based violence. However, we've just seen these numbers skyrocketing, and what we need to do right now is not only to catch up, but it's also to ensure that communities are at the center of the strategies that we employ to ensure that we do not go into any further trouble. And as you mentioned, probably a lot of people are getting sick, and obviously death is looming for them because they are not accessing their ARVs and they are actually defaulting from taking their medication.
The conversation around community-centered initiatives is a really important one, especially, I mean, you make mention of the skyrocketing numbers. I mean, every week in South Africa, 2,000 girls and women between the ages of 15 to 34 are infected with HIV. I mean, that really speaks to a huge loss when it comes to South Africa's fight against HIV/AIDS. We know that HIV is a global war, but South Africa is shouldering the heaviest burden in South Africa, even with the best ARV program in the world.
Yes, with the best ARV program, it basically just means we are able to keep the highest number of people on ARVs. It does really not mean that we are doing a great job. However, when it comes to the number of young girls, we know where the problem lies. The problem lies within patriarchy. The problem lies within political leadership. We do not have any political leadership that speaks out against what the biggest problem is for young girls to getting HIV in this country. Young girls are not having sex with men or young boys their own age. They're having sex with older men, and we are not dealing with that problem in this country, and it's becoming a huge, huge burden on the numbers of people living with HIV. We are not going to get anywhere unless we deal with the biggest problem, which is older men having sex with younger girls, and that would mean statutory rape. That would mean somebody is raping somebody. We also do not get to deal with the fact that these young girls are getting raped inside their homes. And gender-based violence is one of the biggest drivers, as well as alcohol, of HIV numbers in this country. And we do not want to deal with the truth and the reality of this matter at hand. Even in our society, do we still sweep under the carpet some of the realities that these young girls are being raped by cousins, brothers, fathers, and uncles?
You've painted the picture of South Africa's reality, especially now during COVID-19, where we've seen a massive increase in the gender-based violence cases and crimes. When it comes to South Africa's strategy and perhaps exploring some of the reasons why South Africa is not winning in its fight against HIV/AIDS, a lot of the criticism has come around South Africa's reliance on global strategies and recommendations. What are some of the strategies that South Africa should be owning as we try and fight HIV/AIDS and perhaps be able to come halfway when it comes to achieving some of the targets set for 2030?
Yes, it's important for us to know that, first of all, I want to commend that some of the strategies that we are employing is evidence-based, especially when it comes to HIV. However, we are almost as if we are not sure if we should make this move. There is a pill that prevents young people from getting HIV. It's called PrEP. However, there is no political force behind that to say there's this medication. If you are taking it, you are able to prevent yourself from getting HIV. And also the stigma around an ARV prevention method is also a huge problem in our country. However, our strategies are always informed by communities. There's huge consultations that are happening when we do write the strategic plans for TB, STIs, and HIV, and communities give in their input and also mention what are some of the things that will prevent that help this fight. However, as it goes, when some of the strategies are left out, community-based strategies do not sound cute. They do not sound as if it will make sense on the global front. And of course, some of the research-based and evidence-based work does overpower some of our voices.
Absolutely. Thank you so much for your time. And, of course, a lot of important questions and some sort of direction coming out of that conversation with Executive Director at Advocacy for Prevention of HIV and AIDS, Yvette Raphael, painting a picture of the reality on the ground when it comes to the ambitious targets set out for the year 2030, having zero people in South Africa infected with HIV/AIDS.